Okay, good afternoon. Everybody good? Want to always make sure that everybody's good. Everybody's got a good signal? Okay, good thumbs up. Thank you. And appreciate the social distancing here this afternoon. I'm president of Carroll County's Board of Commissioners, Steve Wance, and I got to tell you, I'm sad to be here this afternoon. We have been all in with this, and the first thing I need to do is thank our governor and his staff for the amazing decisions and all of the things that have been coming down from his office. We couldn't do that without him, and he's been an amazing leader and will continue to do so to get us all through this. But as all of you know, Carroll County is now, unfortunately, on the map, unlike the map that we'd like to be on. Let's be clear. We had an incident at one of our nursing facilities, and you'll hear more about that in a moment. And it's important for the public to know the details of what is going on down there, so that we can alleviate some of the hysteria and some of the other things that go along with the associated thoughts and concerns that community has. I want to start off first by reading a statement from the mayor of Mount Airy, the Honorable Pat Rockenberg, and I would like to say this on his behalf, that the town of Mount Airy sends prayers for healing to all those impacted by this global pandemic in our community and in communities across the world. We send prayers for protection and strength to all healthcare workers and first responders who are tirelessly working to save lives on the front lines. He's thanking us, the Carroll County Board of Commissioners, and he has thanked myself for our unwavering leadership and support during what can only be referred to as an unprecedented and uncertain time. We are confident in the swift and strategic response taken to address the outbreak at Pleasant View Nursing Home, and we will continue to look at measures to protect our fellow citizens. Locally, we are following our emergency operations plans, and he continues to make sure that all are in thoughts and prayers. So that's from the mayor of Mount Airy, and I got to say, Carroll County is a little bit different than other jurisdictions. We actually have 8 municipalities that we are also responsible for, and all 8 of those municipalities, including the mayors, have been instrumental in the collaboration as we work together to combat this unfortunate pandemic. Lastly, before I turn this over, I have a statement from one of my colleagues who is the actual district commissioner for that area in Mount Airy. And in these moments, this is from Commissioner Eric Boucher, and it is in moments as this we need the reassurance and commitment of our public officials. Though the news before us is a shock so close to home amongst loved ones, I can confidently say that all the latest in medical procedures and protocol are being executed for the safety of our community. State resources and personnel from the Department of Health are working closely with local officials to contain the infection within the facility. We need to give a huge shout out to all that have been involved, and you'll hear from a couple of these folks in a moment. We have emergency medical personnel that have been on the scene and transporting these individuals. All of them have been in from day one, the first minute that this went down, in the proper personal protective equipment. So we are applauding all of our ambulance and fire folks for doing that too. Need to give a shout out to 2 of my team members in fire and EMS here, Eddie Ruck and David Coe. Both are representatives of the Carroll County Volunteer Emergency Services Association, and they have been instrumental in making sure we get through this as well. I'm pleased to have with me here this afternoon law enforcement also, who has been all in with this. I have my major of the Sheriff's Department, Major Rich Hart, and my lieutenant of the local Maryland State Police Barrack, Lieutenant Rebecca Bosley, who has a message at this time. Lieutenant?
Good afternoon, everybody. I'm Rebecca Bosley. I'm the commander of the Maryland State Police Barrack in Westminster. For everybody's information, this is a multi-jurisdictional effort. We have a great partnership with all local police agencies, to include the Carroll County Sheriff's Office. The area where this outbreak occurred is in the jurisdiction of the Maryland State Police. With that being said, I want to explain to everybody that we will enforce Governor Hogan's executive order. We're asking everybody to calm down and to realize that this is a private property and that anybody trespassing on this property will be arrested for trespassing unless they are duly allowed to be on the property. We're asking for everyone's cooperation, and we're asking for everyone to have an understanding as this goes forward. I, along with Major Hart in the Sheriff's Office and Mount Airy Police Department, are out at this location and ensuring the safety is taken and the precautions are taken to ensure the public is not interfering and that they are also safe. If we could all expect that and we can all agree to that and have an understanding that we don't need anybody encroaching on this property, that would be appreciated. The Sheriff's Office and I stand together in this message to have an understanding that we will not allow trespassers to go onto the nursing home's property. Thank you.
Thank you. And now let's get to the details. I am blessed as the leader of the county to have such tremendous people behind me in order to get through this unfortunate circumstance. And the first person I want you to hear from is an amazing individual who I don't think has slept in about a week now. But I'd like to introduce my Carroll County Health Department officer, Mr. Ed Singer.
Thanks, Commissioner. And I want to just, thank law enforcement for what they're doing. The one thing that I'd emphasize is I don't understand why anybody would want to be down there at the property right now. We're trying to isolate folks who are in that facility because there are quite a number of people who are sick and they need to be taken care of. But there'd be no reason for anybody who's not providing a delivery or providing a service there on that property to be there. So from a health standpoint, there's not any sense in anybody being out there. So the facility's Pleasant View Nursing Home that's in Mount Airy. I think many people are already aware of that. It's a comprehensive care facility with 104 beds. We had 2 positive cases reported on March the 27th, and 64 additional cases were reported on March the 28th. There are a total of 66 residents that have tested positive for the COVID-19 virus, and I don't think it's extremely unusual to see something like this when it's unknown to spread through a nursing home this way. We're awaiting additional results for the remaining residents and symptomatic staff. There are 11 people who are hospitalized, some at Carroll Hospital, some at Frederick. One of the residents, a man in his 90s, unfortunately, last night was our first death. This man in his 90s passed away yesterday evening. He had a lot of underlying health conditions. The facility is complying with the federal and state guidance regarding infection control, including isolation of residents presenting any symptoms of COVID-19, and they're screening staff when they come in and taking the other protective measures that are required. Some asymptomatic residents have tested positive, so all staff are wearing full PPE at our direction. We're ensuring through the Strategic National Stockpile and through our emergency management channels that we're able to provide adequate PPE. We're also working very closely with the facility. One of the things that's important is PPE is in short supply everywhere, that we conserve this PPE and make sure that there's enough to go around for people who really need it. But we are ensuring that they have adequate PPE to deal with the patients there that they have to care for. We provided additional gowns, face shields, gloves, and masks for people within the facility. We're also trying to assist the facility because they're struggling because some of their staff haven't been able to report. They're struggling to be able to do their administration and to be able to staff and take care of their patients. So we're assisting them in trying to work through some of their administrative issues and being able to adequately care for their patients. We appreciate the support of all of our community partners who provide compassionate care for the residents of Carroll County and this facility. Carroll Hospital's really stepped up to the plate. They've done a lot throughout this whole pandemic as we've gotten started. They've stood up testing anything that I've needed, I know that I can reach out to the president and vice president of our hospital, who have these roles in LifeBridge as executive vice presidents in the LifeBridge system as well, and that they'll be there for us, and they'll provide whatever assistance they can. And I know they're under a lot of stress at this point in time, and we're all trying to prepare for what might be ahead of us as far as potential for a surge. So I can't thank them enough for their support. The Carroll County Board of Commissioners and our emergency management here in Carroll County have been very instrumental in assisting the health department in meeting the needs of our community. And our EMS system that the commissioner already mentioned, and Dave Coe's just, I think he's a godsend, and he's been extremely helpful to us in anything that we've needed. They've been doing the things that they need to do to protect themselves, because the last thing we need, and we've heard about it from happening in other places in this country, is for our EMS to potentially become sick and then to weaken that system. But by wearing proper PPE, they know they can be properly protected, and they're doing a great job with that, and they're providing whatever other support we've needed whenever we've asked. So we've been doing a lot of coordination. State police and other law enforcement that I mentioned, they're working with us very well as well. We're working with our local and state partners to ensure that the patients are receiving the appropriate care in this facility and that they're being taken care of. So one of the things I wanted to mention is the facility is not moving patients in or out of the facility except when there's an emergent need for a higher level of medical care to transport. So there are no patients going in or out of this facility at this point in time. I also wanted to talk about, because I've heard some concerns from people in the community, and I just kind of wanted to put this out there, that this is an outbreak within a facility, and we're doing what we can to contain the outbreak within the facility, but there's really nothing more other than what the governor's talked about with everybody in the community about social distancing, following those types of protocols, and staying at home, that we would want to do any differently here in this part of the county than any other part of the county. So this is relatively contained, as an outbreak within a facility. It's not something that the community should be overly alarmed about, and we're doing everything that we can to address it. So thank you all for your time, and I'll turn it back over to the commissioner. Thank you.
And I will take some questions after this is over, but another tremendous partner in this whole effort, as Mr. Singer has pointed out, is our local hospital, Carroll Hospital Center, who's part of the LifeBridge system, has been just, without a better word, amazing in this whole thing. At this point, I would like to introduce, and she's got a lot of titles, so she's the executive director, the president, the vice president, and she's the face of Carroll Hospital Center, Leslie Simmons.
Thank you all. It is indeed humbling to be here this afternoon together. Carroll Hospital and LifeBridge Health has been in constant communication with the county health department, our amazing partners, and Pleasant View Nursing Home. We are working desperately to try to coordinate all that they need for their residents. We have been providing staff support, supplies, anything necessary to try to help them provide the care, as well as continue to try to prepare ourselves for any influx in patients that we may have at Carroll Hospital. Our goal is absolutely, without a doubt, to stop the spread of the virus and to protect the members of our community and provide the best possible care that we can for our community. I have to tell you, I am so grateful to be a part of this team and a part of this county that rallies together to support one another and provide for this community. I'm also exceedingly grateful for the caregivers that proudly and preparedly take care of the patients that are coming to our facilities to seek help. So what I would ask of you is to please be mindful of our current guidelines. Please continue to have good social distancing, stay home so we can stop the spread of this virus. I will let you know that we are under the current guidelines for COVID-19 testing. And if you need to seek care for respiratory symptoms, here is what I would advise you to do. If you have no symptoms, you do not need to be tested. If you have mild symptoms, you should stay home and monitor your symptoms. You do not need to be tested. If in fact your symptoms worsen, contact your healthcare provider who can help you decide if you do need testing. If your symptoms worsen, or if you are age over 65, have other medical issues, or you're immune compromised, call your healthcare provider. Even if your illness seems mild, you are at a higher risk of severe illness from COVID-19, and your health provider will help you decide if you need testing. And of course, without a doubt, if your symptoms become severe or you have trouble breathing, seek immediate medical care. If you think you have been in contact with someone with COVID-19 and now have symptoms, contact your healthcare professional for guidance, and make sure you get your information from reliable sources. There's a lot of information out there. Our health department, our Carroll County Health Department, is prepared to respond to your questions. They have the COVID-19 call center. It's currently open 7 days a week, 8 a.m. to 5 p.m. The number 410-871-4848. Thank you.
Leslie, 876.
Oh, excuse me, 410-876-4848. Again, 410-876-4848. Thank you.
Okay, on behalf of my colleagues, Commissioners Weaver, Frazier, Boucher, and Rothstein, who are all in this with me, we can't say enough. Look, this is a novel virus, one with no cure, no vaccine, highly contagious, and let's be clear, it's deadly. As you've heard from Ed and Leslie, you have got to make sure that you are doing your social distancing. I've had reports from around the county from some of our bigger box stores where aisles were packed with people. I'm just not sure what folks are not understanding about this deadly pandemic. You have got to make sure that you are protecting not only yourself, but when you go home, your family, your moms and dads, your grandparents, your kids, your neighbors. Please, we can't say it enough, and Governor Hogan has said it more than he wanted to say it, and we're supporting, again, everything that he's doing. You have got to make sure that you are only going out when you have to. With that note, I'd like to thank everyone that is affected by this, and we are all in this together. And if there are any questions, we'll take them right now. Yes, ma'am.
Hi, Julia Bacano with CBS News. You said 66 positive cases. Does that include residents and staff, or solely residents?
Okay, it's a question about residents and staff and the positive test. Ed, you want to take that one?
So at this point, the 66 positive cases that are reporting are all patients, residents of the nursing facility. We're not aware of any positive tests for any of the staff.
Anyone else? Over here. Yes, ma'am.
Explain a little bit more about what's being done. You said there's some staff haven't reported to the facility. Why is that? Is that they're underreported?
Sure. Ed, this is a question about staffing at the facility. Is that correct? Ed, you want to take that one?
So I can only make assumptions. People are afraid at this point in time, and the question is about staffing at the facility and why staff aren't showing up. I'm certain that some people are afraid. We have 66 infected individuals who were are or were at the nursing home. Some of these have been transported to the hospital at this point in time, and this is extremely serious because of the vulnerable nature. If somebody's in a nursing home, they're there for underlying medical conditions. So we have 66 people who with underlying medical conditions who who are infected with this virus. So some people may have some type of mild symptoms or whatnot that are not reporting to work for reasons that are truly legitimately medical, but there are probably also folks who are afraid and may not be reporting to work because they're calling in and saying that they're self-reporting that they're sick because they're afraid to be in the facility. Now, we've been working really hard, and I'd encourage folks, we've been working really hard to try to find support for the nursing home. We've reached out to temp agencies and things of that nature to make sure that they have adequately staffed nursing support and nursing assistance support. Maryland Responds is still out there, and we've been trying to pull on members of Maryland Responds. We've reached up at the state level to try to get volunteers, and we're doing everything we can to support the staffing that's there at this private nursing facility through any means that's available. So, personally, I think that there's probably a lot of this is fear. I don't know that I can't tell you numbers that are or aren't really sick. The bottom line is, though, we certainly don't want people who are sick coming into work anywhere, and so we have to take people's word for it. And the facilities having to figure out how to deal with their staffing shortages.
Okay. Yes, ma'am.
Is there any particular reason why the 11 patients were transported to 2 separate hospitals?
Which one of you wants that one? That question is in reference to the transport of patients to various facilities.
Yes.
Leslie.
Yes, so we actually had patients transported to 2 facilities last night, and actually the day before. And when you're transporting patients and you have a high volume like that, you're trying to get them to the closest hospital, but also spread it out as we try to manage the surge. So in fact, 11 patients are at Carroll Hospital and 6 patients went to Frederick.
Yes, ma'am.
I know prior to the outbreak that the facility was putting in preventative measures to curb the spread of the virus. After the 2 cases were confirmed positive on the 27th, were there any other measures implemented to prevent a further outbreak?
So preventative measures after that first outbreak, Ed, that's a question for you.
So and I can't remember what day it is right now. So the question is were further measures put into place? And to the best of our knowledge, the facility was doing everything they were supposed to be doing up front. We actually went down and made a site visit after we had our first positives because we wanted to go down and kind of put an eye on what they were doing from an infection control standpoint and whether there were any things we thought they could do to improve. And we generally found that the facility was doing most everything they were supposed to be doing. We had a couple of minor suggestions for them. Again, comes back to the most difficult thing is for them to maintain their staffing. So they've actually increased since the outbreak was detected. We've increased their level of PPE. I reached out to them and I advised them that they needed to be wearing full PPE. They had been wearing N95 masks, but they weren't in full gown and face protection and gloves at all times. But because of the number of cases that we have in the facility, we thought that it was prudent that everybody, including everybody from the folks who are working in dietary to their maintenance folks to anybody that was going to be working within that facility, be protected so that they didn't potentially become infected and not be able to continue to provide the critical services that they need to support these patients in this difficult situation. Thank you.
Okay, one more.
Yeah, I was just gonna ask, what sort of communications do you guys have with the families of those?
Communications with the families of those affected.
Well, I guess I'll answer that one. So the question was about the communication with the families who are affected, and really, this is a private nursing facility. The patients are clients of the private nursing facility. So when it comes to dealing with their loved ones and the family members that are in the facility, the staff at the nursing home are having to deal with those questions. Now, you know, they're under a lot of stress right now, and I know families have a lot of questions, and I would really encourage people to minimize the amount of calls that they're making to the facility itself. If you have general questions about COVID-19, I would again encourage you the same thing that Leslie Simmons encouraged you to do. Go ahead and call the health department's hotline. That's why we've got it staffed. We can try to answer those general questions. It's 410-876-4848. But you know, specific questions related to a loved one that's in the nursing home, we're not going to be able to answer that because we're not directly caring for the patients. Those have to be answered by the staff at the nursing home. But I do ask everyone to please keep in mind that this is extremely stressful for the staff that are on site trying to provide care. With this number of sick individuals, it's a lot more work for them. And any calls that people make, if they're unnecessary, take away from time that they can actually care for the loved ones who are actually there in the facility. So I would would say that you do need to ask the nursing home specifically, but encourage you to try to limit that as much as you can. And the health department has regular contact with the nursing home about a number of things. And I've specifically said there's one point of contact for the health department. Everybody gives that person their questions, and then we call, and it limits the amount of time that they have to spend in answering things. So if we could try to help them out by keeping that in mind, that would be great. Thank you.
Okay, these folks will be around after. If there is anyone that has specific questions, as long as you keep your distancing thing in mind, please, we'll provide that ability for you to be able to talk to them. Look, this has been something that's really been taxing our resources here in Carroll. We never thought that we would be in a position like this with an incident of this magnitude. But trust me when I say we're all in this, and all of us, as you can see by the partners that I have here today, are doing every possible thing that they can to ensure that it stays on that facility, number one, and that everyone in this county remains protected in the most way that they can. But we can't do that without the public's help. Again, I can't say it enough. Please practice social distancing. And we implore everyone to please go by the guidelines that have been set forth by not only the individual counties around the state, but Governor Hogan as well. We won't get through this unless we do that. And I think it's very important to know that until everyone starts to pay attention and do what they're told, we're not going to get through this. We've got to do it as quickly as we can, and that means paying attention to what has been said. So again, I want to thank all of those that came out today. This is, again, an unfortunate situation that we are in here in Carroll, but I'm very proud of the fact that we are working very, very hard to mitigate the situation here. Again, thank you. I want to implore everyone, please stay safe. This is unlike anything we've ever seen before, and we've got to all work on this together, okay? A couple folks will be here if you need afterwards, and thank you very much for your participation today.